My topic is looking at cognitive behavioral therapy as an alternative treatment plan for pain management. CBT is a practice that helps the individual become aware of automatic or negative assumptions, patterns, or behaviors that may be contributing to their pain. So, the mind has a huge impact on our perception of pain, which can slow or halt our patient's treatment progress. CBT can help patients develop healthy coping strategies for pain management and help them to reframe their perceptions of pain. Cognitive behavioral therapy is a non pharmacological option to reduce pain perception by improving the patient's ability to cope with pain. So it works by utilizing the gate control theory of pain. Um, Through these sample strategies listed of cognitive restructuring, relaxation techniques, activity pacing, and some other strategies, we can send non noxious stimuli up to the brain and block its perception of a painful stimuli. So we'll go more into detail of these specific strategies, but these can also help improve the patient's sense of self efficacy and their confidence in controlling what they feel. So it's giving them a more positive outlook on what pain is. They can be beneficial over long-term opioid use because we're enhancing patient education by teaching them about what pain is and how it works. And we also know that opioids are not an effective long-term method of pain management, and there's a higher risk of addiction with them. CBT can also be a tool to stop the pain medication sooner. It's also more effective as it can be integrated into a PT session without extra visits or materials. So, why should PTs care about cognitive behavioral therapy or use it with their patients? Chronic pain is a prevalent issue in our society. About 20% of Americans report living with chronic pain, and a meta analysis of some randomized controlled trials looking at chronic pain management came to the consensus that cognitive behavioral therapy is actually recommended to treat chronic conditions. So, this is just another option to utilize if other traditional therapeutic methods are not effective at managing a client's pain. So, just another tool we have. So, the nice thing is, physical therapists know how the physiology and psychology of the brain and of pain work, and we can use that to our advantage and influence how our clients experience pain. So there are some specific populations where CBT is more effective in than other groups. So I want to emphasize this is not a one size fits all approach. Most of the research done focused on chronic pain. So CBT should be integrated as a complement to other manual therapy modalities, therapeutic exercise, those kind of things. So with that being said, some populations this can help are with chronic pain. So like I said earlier, CBT is actually recommended to help with chronic pain treatment. A study found that the mindfulness practices of CBT can help reduce pain, catastrophizing, and physical disability. Many patients with chronic pain tend to live in fear of exacerbations, or they'll avoid activities where they think that might increase their pain. So, studies implementing CPT have found patients have better self awareness and regulation because they have to slow down and actually process what they're feeling before reacting. So, CBT works to help these clients accept painful sensations and reflect on them rather than trying to control them. It can also help with low back pain or post lumbar surgery. So, another randomized control trial had physical therapists work with patients to create weekly goals in addition to an activity plan. And these goals included like their functional ADLs, and the patients rated how well they think they could achieve the goal. The physical therapist helped the patient work through some cognitive behavioral strategies, such as breathing and problem solving, to help reach the goal. And they found that patients who met their goals had better functional independence after their surgery. Fibromyalgia is another group that it can help. So this study used PNE in addition to CBT and exercise, and participants were educated on what pain is and how it affects the brain. So the pre and post evaluation revealed that this multidimensional approach helped improve some of the main symptoms of fibromyalgia. Another interesting one, it can also have an effect with return to sport. So one study found that CBT principles helped with athletes' recovery time, their stress and anxiety, improve their overall performance, and reduce the risk of re-injury. So there are some formal training available for CBT that we'll talk about in a second, but here are some of the main strategies that can be implemented immediately into the clinic. So the first one is activity pacing. This talks about making a task time specific and not pain specific. So the client's not letting pain control when and where they do something. So the physical therapist will help gradually increase the intensity and frequency of an activity. It gives the patient more confidence and shows them that they can do more. Cognitive restructuring is one of the main components of CBT. So it helps to identify negative thought patterns or fear avoidance behaviors and reframe them. So the patient is learning to accept and be curious of the sensation they're feeling rather than being fearful of it. So reflecting and asking, what does this feel like? Have I felt it before? Do I feel it anywhere else? Can be helpful in breaking down the feeling and separating actual pain from what the brain thinks it's feeling. So this is a lot of education on the PT's part to help the patient understand that pain doesn't always mean tissue damage and how they would work through a flare-up. Goal setting is another one. So this is encouraging the patient to identify things that they wish they could do that they can't do right now, and completing them from the least to most difficult to help gain their confidence. And then distraction involves the physical therapist diverting the patient's attention away from pain and focusing on other aspects of the activity. So for example, if you're in the clinic, this could look like keeping them engaged in a conversation while they're doing an activity to keep them from thinking about the pain, or having them focus on other things in the environment that they enjoy that would keep them from thinking about pain. Then there's also graded exposure, so gradually increasing the intensity and physical stress, which actually reduces the perceived harmfulness of an activity. Relaxation is another big one. So this involves teaching the patient deep breathing exercises, visualization, muscle relaxation techniques that kind of help calm the nervous system down and reduce their perceived pain. And then the last one, problem solving, is helping your patient problem solve through different scenarios, how they handle things at home or if they're on their own, how to handle plateaus in their exercise programs, and how to transfer those skills from the clinic to when they go home. So in the middle are some outcome measures listed that look at grading patient-centered goals. There's one specific for fibromyalgia. The PROMIS score is a patient-reported outcomes measurement information system that measures pain, emotional distress, their societal roles and physical functioning. It gives a little more holistic view of the patient. And then there's also two examples that can be used in the clinic of a goal assessment scale, and then the steps of the multi-component treatment from the fibromyalgia research study, to kind of give some examples of how this can be integrated into treatment. So there is formal training available. The Duke Continuing Education program offers an extensive course that goes into more depth about CPT use in physical therapy, as well as an online option at the Beck Institute. That's a course just to kind of learn more about CBT in general. So using CBT, patients can equip, or physical therapists can equip patients with strategies to manage their pain better, empower them to take an active role in their health, and have a better outlook on their recovery. And then these are my references, and thank you very much.